Está en la misma página, ¿verdad? Okay, good morning. We're back. Sorry, we were dealing with some technical issues. We're happy to be here. Okay, I think I think it's working. Okay, thank you so much for joining us. I have here amazing Dr. Velazco.
Hi.
Your follow-up doctor. And I'm Linda, I'm your nutritionist. And today we wanted to share with you some information about weight regain prevention. We normally read your emails and your posts, and one of the major concerns about most of our patients is actually how to deal with the weight regain and what are the alternatives that we have if that happens. So that's why the intention today is to talk about prevention, and if you're dealing with this, if you're dealing with weight regain, what can we do about it? So as you know, obesity is a life-limiting disease, and it's associated to different conditions: high blood pressure, diabetes, different types of cancer. And that's why there's many methods that help to lose weight. So one of, as you know, the first, and I think most of you have been doing different diets during your life. So different diet systems, you name it, Weight Watchers, keto, which is really popular now, paleo, so different types of diet. It's not that the diets are right or wrong, it's just sometimes they're not sustainable or they're not adequate for all patients. Yeah. So bariatric surgery is a great tool. It's one of the most amazing tools, not only for weight loss, but weight loss maintenance. But it's not a magic one, and that's something that we normally say, especially both of us during our talks when we see you at the hospital, when we post different information. We always like to remind you that it's a tool. It's an amazing tool, but there is also... Okay, as you know, we're not so great with the technical issues that we're trying to handle. Oh, hi there. Hi, Tanya.
Start sending your questions so when we're done talking about, it's gonna be a short talk, but we're very excited to answer all your questions. I know some of you have all emailed us on the past, so that's why we are making this Facebook Live to help you to understand what you're going through or how to avoid it. Okay, start sending your questions. Atale will help us to read your questions so we can answer them, and we're gonna give you like a resume, okay, on how to avoid and what causes you to regain weight.
Okay, so first of all, is it normal to have some weight regain after any surgery, you name it, band, gastric sleeve? Gastric sleeve and gastric bypass are our most common surgeries. Also, switch duodenal, it's one of the surgeries that has been more common lately. But normally we have, I will say most of our patients, most of you have had a gastric sleeve or are thinking on having a gastric sleeve or a bypass. So with all the different techniques, what will you say, doctor? Is it normal to have some weight regain?
Yes. At the beginning, you will lose more, and it's something that we talk commonly with the patients. You can over lose weight. Some patients will say, "Oh, I don't want to be too thin." That can happen. So sometimes you will have like a number that you want to reach, and sometimes you will pass that number. Why? Because your body, it's like like a roller coaster, and for you to be able to stop that weight loss, of course you need to be eating lots of protein. Like we always tell, you need to reach your goal of protein, but you can overdo or you can pass that number. So there's a weight loss. No, there's some regain of weight because you over lose weight. We're talking about 15 to 25% of the total lost weight that you can regain, and it's normal. It's common for you to gain that weight after maybe a year or 2 years. But if if you're gaining more weight, it's not so common. So it's very, very important for you to reach out if it's normal, if it's not normal, for you to track what you're eating if you're concerned about gaining weight, so you don't text us or email us in 2 years and say, I regained 80 pounds. No. We need you to reach out for us early, very early. So if we can tell you it's normal, keep on doing it. Whatever you're doing good. The amount of protein that you're taking, it's good. We always ask for patients who are concerned about gaining weight a food diary. So you can start with that, but reach out for us early, really early, when you're gaining some weight.
Yes, and that's why we always tell you at this point, we have been working a lot of years with Dr. Garcia already. How long have you been working with Dr. Garcia? Almost 8 years?
9, I think more than 9 years.
Okay, I've been working with Dr. Garcia almost 6 years, so we have thousands of patients. So we normally tell you, contact us if you want to email us, or it's easier to use Facebook, or email us earlier so we can prevent. If you feel that you're falling off the wagon, as some of our patients say, email us, contact us so we can do something about it. So as Dr. Velasco was saying, some weight gain, some weight regain, it's normal and it's expected after the second year. So remember, the first year will be basically a honeymoon. No matter what you eat, no matter what you drink, you will keep losing weight. Yes, yeah, losing weight. And even if you are not following the diet as we're recommending, so all of you know me, I'm like, follow the guidelines, read the guidelines. But even if you eat other things, you will keep losing weight. The second year, we call it the tough year, because that's when we try to make the body understand, okay, this is the weight that we want you to keep it stable. So it's difficult for the body to understand, like, what's going on. We had a massive weight loss. Should I stay here? Should I keep losing weight? Am I gaining weight? So it's a complex process. So let's say, to be clear, 10 to 25% of the weight loss could be regained on the total weight loss. Yeah, could be gained after the second, third, fourth year. Above that 25%, that's when we consider that it's a greater, gain. So, but in the normal, if you gain about 10% of the loss, 15% of the loss, it's in the adequate range. We understand, both as health practitioners and also as patients, that can create stress, that can create fear, depression, and many, many things, mainly psychological. This sense of, oh, am I failing? Do I need another surgery? What's going on with my body? Am I going to gain all the weight loss? So a lot of thoughts about this. So let's talk about, now that we said how much is normal to regain. Again, 10 up to 25 will be considered normal from the weight loss. Above 25, then we need to consider different options. But ultimately, what are the causes? So Dr. Velasco can let us know about a little bit the anatomical causes and the physiological causes, and I'll talk to you a little bit about the psychological and behavioral causes. So what can you, Dr. Velasco, do you consider the anatomical and the physiological causes to be? more common than the psychological and behavioral?
No, absolutely no. We need to think everything as one. Okay, we need to rule out if it's an anatomical changes. If you did the band, if you have done the sleeve, there are restrictive surgeries. So what can happen? You start at the beginning, you will eat certain amount of food and you will feel very, very sick, or you will have a lot of discomfort when you start overeating. With time, the stomach, it's a muscle. So if you start overeating, it gets bigger and bigger and bigger. So if you do the sleeve, that can lead to greater amount of food that you're eating. If you did a bypass, the bypass, it's the stomach, they make a pouch and then they do a connection, intestinal connection with the pouch. So what can happen in a bypass or the other malabsorptive surgeries? The pouch gets enlarged as well, but the connection can get wider. If you start overeating at the beginning, the connection will be very small, so you will have restriction when you eat, and once the food it has passed, then you will be hungry again like normal. But if you start overeating, the stomach gets bigger and bigger and bigger. Another change can happen with the malabsorptive types of surgery. You can have a fistula. A fistula, it's a hole on the pouch, and that can lead to, on the other connection where you don't use the stomach, there's a connection, so that can lead to weight regain. Psychological or physiological, sorry. What can happen in your body that can lead to gaining weight? Females, we have, like I always tell them, we have so many things against us. We have hormones, which men don't really have a struggle with, but once you go into menopause, you start to gain weight.
Pregnancy. That's a
yes,
common one.
Pregnancy. It's very important that you mention that, Linda. When you become pregnant, we always tell patients, wait until you reach your goal. Okay, once you stall for maybe a year and a half or 2 years, then you want to get pregnant. Okay, but okay, you're already pregnant. What happened to the entrance, the sphincter in your stomach? That gets wide. Why? Because of hormones. Why? Because your body needs to eat more to feed your baby. The body, it's just very
Magical.
wise. It's wise. So it will open up, so you will have no restriction. So what can you do by being pregnant and not gain weight? Follow your nutritional guidelines. Even if you have more capacity, if you go back to eating bad, you will gain like crazy weight. And once you have your baby, with all the hormonal changes that can stay for up to months, even a year, it will be very, 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 very hard for you to have restriction again and to lose all the weight that you regain. Okay, basically hormonal changes can lead to gaining weight. Even if you are doing a good diet, if your thyroid is not working properly, you will not lose weight. Always tell patients, do not stop your thyroid medication, and you need to continue to be with your PCP. We cannot change the dosage of your medications. You need to continue to have follow-up with your endocrinologist, okay? So it's very important for you to always check every 3 months, every 6 months, check your hormone levels. That can be one of the, advice that we can give you. Go back, do your testing. You need to follow up with your physician just to check. We will check your lab work and we will say, oh yes, you're having problems with hormones, but you need to continue to be with your PCP. We cannot do changes in your medications, okay?
Mm-hmm. Yeah, so actually we get about 10%. Yeah, about 10% of our patients will send the blood results during the first year. Remember, you get an email as a reminder. They change every 3 months. We ask for different things. So it's something that we would like you to take advantage of, because we can, find any risk patterns during the first year. So that is available for you. So definitely the anatomical and the physiological changes could cause weight regain or inadequate weight loss during the first year, but they're not the most common. So what are the most common causes that could lead to weight gain? Graze eating, grazing during the day, lack of physical activity, alcohol intake, psychological disturbances, depression, an antecedent of a food disorder, like lack of sleep. That's another common one. Stress definitely changes your hormones. Those are the most common causes. Grazing, lack of physical activity again, and
empty calories.
Of course, that mainly comes from alcohol and some sweets, but definitely following the guidelines will give you, the first step to become successful. So another thing that we don't want to forget, and we were discussing that yesterday and this morning, about something that probably you haven't read, but it's really, really important, and that's about physical activity. When we undergo a bariatric surgery, we lose lean body mass. That will be water. We lose a lot of water during the first month. Water, muscle, and fatty tissue. When we lose muscle, visualize muscle as gold in your body. Muscle keeps your metabolism active. So if we lose a lot of proportion from lean body mass, then our metabolism gets a little slower. So that's another thing that can be related to weight regain. So how can we prevent lean body mass loss? First of all, get your protein. That's why we're always talking about reaching your protein goals. 60 to 80 grams for female, 80 to 100 grams for male. And exercise. We don't want you to become bodybuilders. We don't want you to be in the gym 3-4 hours. And well, with this COVID situation, we are not actually recommending that. But exercise as much as you feel comfortable. We have patients with a BMI of 70, 60, 40. So it will be different, the type of physical activity that we recommend, but even stretching, walking,
activity,
elliptical, just activity so you can keep your lean body mass. If we lose a lot of lean body mass, we can sacrifice from the basal metabolism. That's the calories that we burn resting. We can sacrifice about 500 a day. So yes, the metabolism can get a little slower. So that's another thing. So let's say we're not exercising, we're not beating the protein goals, we're drinking alcohol, we're doing sweets. Those are going to be enough causes for weight regain. Dr. Velasco really wanted to talk about a little point about alcohol intake and how after the surgery some addictions can be mutated. Maybe you didn't drink alcohol before the surgery. Maybe you didn't do a lot of sugar before the surgery. And now after the surgery, and that's another common email that we get from you guys. I didn't like candy. I didn't like sweets. I didn't drink alcohol. And now I feel like I'm doing it more. So what are your thoughts about that, Dr. Velasco?
We need to remember that obesity is an illness, and food can become something comfortable or an addiction, even an addiction. If you know somebody that has been addicted to whatever you want to call it, illicit drugs, food, alcohol, smoking, gambling, whatever you want to call it, you might have an addictive
Pattern,
yes. So if you see food as a comfort or as an addiction, when when they take that away from you, you will find something else. Okay, so that can lead to alcohol consumption. Being smaller, having a smaller stomach, whenever you drink, you will feel that satisfaction or how can you say, like a boost or faster,
or even like a calming,
faster
sensation.
Why? Because the amount of food that you're having is very small. When you drink one drink, mixed drink maybe, the comfort that some patients will feel with alcohol will be faster. So we do have a lot of patients that will start drinking, and that becomes an addiction. So it is very, very, very important for you to have someone. If don't some people will notice that the pattern, the way they're behaving, it's changing very quickly. So always do not wait. Okay, we need you to in just, if you're planning to have weight loss surgery, any type of weight loss surgery, you need to reach out to a psychologist. You need to reach out to a physician. You need to reach out for maybe psychiatric help. Why? Because you don't know why you have a problem with obesity. So we need to make sure that we're the healthiest up here and in your body to go through that journal. But if you never had that on the past and you start to becoming not addicted, you cannot say that at the beginning, but if you are concerned that you're liking something that it's not good for you, plus that will lead you to greater loss of muscle as well. So always when you see a behavior like that, reach out to someone right away. Support groups, your physician, your nurse assistant, whatever you want to do. Okay, we need you to have like a backup plan if that happens.
So once you lost the weight during the first year, how can you maintain the weight loss? I think that's part of the idea why we are here today. So the main idea, yes, some weight regain is expected. So don't panic, that's normal. The body will try to adjust. So first of all, that will happen. I will say unavoidable. Some weight loss will will occur on the second year. You can always check in with us like, hey, I started with this weight, this is my current weight, in order to help you adjust and with the maintenance. Yes. But how can we maintain this weight loss? Eating behavior and dietary choices are really important. Try to get your protein in. Get plenty of fluids daily. Take your vitamins. That's really important. There's nothing that you can't eat or drink for the rest of your life. Nothing, like not even cake, not even a glass of wine. You will be able to eat pretty much everything. But as we said before, this is not magic. This is a great tool that forces you to eat mindfully. This is the main idea. The surgery will make you stop to eat and drink certain things at the beginning. Why? Because you will feel pain, you will feel discomfort. But past the first and the second year, those mechanisms they start changing. We start producing more ghrelin. There is less restriction, as Dr. Velazco was saying. So learning during the first year to eat a high quality diet, a good choices, again, your protein, low carbohydrate, not zero carbohydrate. We're not recommending keto, we're not recommending paleo, we're not recommending for you to follow a strict diet. It's just acquiring new habits will be really important. We need about 5 to 6 more meals during the first year. On the second year, maybe you just need 3 meals and 1 snack, because you will be having a greater capacity. Remember, you start with a stomach of about the size of 1 egg, and then you will be having about a cup or a little more, depending on your muscle, on your height, on your individual needs, and on your physical activity. So that's really important, how we feel that little stomach. So high quality foods. Second, physical activity. So we can maintain an active metabolism. We keep our lean body mass. And also exercise, as you know, helps with stress, makes you feel more relaxed. This was a difficult year for everyone since the COVID. We have been getting even more emails with people being concerned about gaining weight, drinking more alcohol, not being able to go to the gym. Do what you can. That's really important. Do what you can. There is a lot of options in Instagram and different social medias for exercises at home. So keep yourself active. The third one, as Dr. Velasco was saying before, sleeping, having a good night's sleep, sleep quality, and not having a lot of changes on your night patterns will be important. Not having an adequate sleep can also cause irregular eating patterns and also changes on your hormones.
Depression.
And also checking your vitamins. Vitamin D also has been linked to depression. So keeping your vitamin D adequately, getting some sun exposure, and good night sleep.
And one thing that I forgot to mention, it is very important for you to keep track of whatever you're eating, your meals, exercise, and you can even track your sleep. They're in your smartphones. You can track your sleep with some gadgets. You can wear your watch. You can even have like a ring or a bracelet, so that way you can track how much sleep you're having, and if it's a good quality. We have a lot of patients that suffer from sleep apnea. That whenever you're losing weight, that will go away, but it's very important for you to follow up with your specialist about your sleep. What else?
Yes, and again, I think that if we understand that the surgery, it's a tool, and always if you're having this fear of having weight regain, trust us, is the most common email. We know it, and there's a lot of fear around that idea of weight regain. First of all, if you need us to assess your case individually, just send us your goals, your expectations, so we can let you know if that's a real expectation as for weight loss and weight maintenance, so we can always help you with that. But there is no hidden information, guys, honestly. With or without the surgery, our recommendation is to try to keep it as healthy as possible, not only about the food, as we said before, but also about what we're mentioning, physical activity, taking your supplements. With or without the surgeries, we recommend supplements. As you have seen with this COVID situation, getting your vitamin C, having your vitamin D in good level will benefit pretty much everyone. You are in great with the surgery, so taking the right supplementations will be really important. So I think that we can start answering some questions. We see that we have been you have been sending there, and thank you so much for joining us. We had some technical issues, so we couldn't see anyone. We were a little scared, like, hey, we didn't know how to do the event, but okay, let's do that. I just saw a question about when you can start eating salads. Salads you can start after day 35th, and it's about chewing everything completely. A lot of people don't do well with salads, mainly because of the size of the vegetables and not chewing completely. So just after day 35th, chop everything really well, and you can introduce fresh vegetables to your diet. Vegetables and introducing different colors, basically all the colors of the rainbow in your diet, it's really important, and that could also be a great tool to prevent weight regain. Vegetables will give you fiber, water, and will help you feel satisfied. Yeah. Mm-hmm.
Okay, so when it was a question about when to stop your protein shakes. Your protein shake start to decrease whenever you can eat the chicken, the meat, whenever you can eat your protein in a good amount. What would you say for the first couple of months, you will need to have 2 to 3 shakes, depending female or males. But I think maybe in the 3rd month, you start with 1 less shake.
Yeah. Mm-hmm. Yeah. So just I always tell our patients, visualize your stomach like a baby's stomach. And as you know, the babies basically survive on milk at the beginning. It's the same with you guys. Protein shakes are so important. You need the protein shakes. It's not that we want you. Some people are like, why do you want to make me take the protein shakes? You need them. It's a need at the beginning, because there is no way that you will be completing your protein from food if we don't do, the additional protein shakes. You are not going to be meeting the goal. So at least for the 6 months, you need protein shakes daily. And then after 6 months, possibly, depending on your body's ability to tolerate, you could be off the protein shakes. What I commonly observe is that people take it up to a year, and those who are heavily exercising, they take it long term. But as for a need, at least 3 months, as Dr. Velasco said, and then, but the most common thing will be for 6 months, to be honest. And there's different varieties. We recently posted about the best protein shakes. You should be seeing that in the support group. And we will be posting about the best protein powders that you can start using after the 2nd week, and just blend that with fruit. And you can also do your whole food shakes. So what else do we have?
Kim Ross. I have gained 25 pounds in the last year. 2 hurricanes brought back all the bad eating habits. Do you have a reset plan? Like we said, stress. The stress can lead up to, whenever you're stressed, you're not thinking properly, okay? So yes, of course, you can, not a reset plan, you need to get back on track. There's no other way. This is a tool. We have it. Okay, so what does the tool need for you to use it correctly? So how do you go back? Exercising, eating your meals. What you can do, Kim, is go back to whenever you did the surgery. Protein shakes, you start with smaller portions, you start to eat 3 times a day. You cannot, if you skip meals, you will start making your metabolism slower and slower. So 3 meals, maybe 1 snack, just a snack, okay? If you're not having a lot of restriction, you can do the reset pouch. Yeah, you can do.
Yeah, you can definitely do a reset. There's a lot of discussion about the reset, but think about it. The reset will last 3 days to 7 days. And healing our relationship with food, and that's another important thing through mindful eating. We're looking for something sustainable. When we do the surgery, we're looking for a tool that will last for the rest of our lives, right? So observing, okay, I'm stress eating. Why am I stress eating? Is it because, what does it mean when we do stress eating? Is it because I'm eating more frequently? Am I eating more sugar? Like, what are the things that are happening when I get stressed? So that will be the main thing, observing. And observing with curiosity. Okay, during my first year, I have a gastric sleeve. During my first year, I lost weight. Why did I lose weight? Because I was eating less sugar. I was eating more protein. More like an observation exercise. I will recommend that for you to start observing. And that was a question from Kim, right, Kim? Mm-hmm. So yeah, just observing what was going on around my life that caused for you to have a food as a coping mechanism. That's the main thing. And what can you do when you get stressed in order to cope with the stress? Mm-hmm. So more tools. But if you analyze it, it's not so much about the food, but the food as a stress response. So there's different techniques, mindfulness-based stress reduction, mindful eating, exercise. Again, exercise is so powerful for stress management, and perhaps utilizing those tools will help you to be more compliant with the diet. And we can post some resources, and since we're not really we haven't done a lot of lives, we don't know if we will be able to post some resources, but definitely we can do it through the group. And we have a couple of quizzes that we can share with you, and some resources that can be helpful with that. What else do we have, Doctor? I struggle. Hi, Misty. Hi, Stacy. Hi, Tiffany. Hi, Pam. Hi, everyone. Thank you so much for joining us. I struggle with getting enough liquids, and I'm in a constant state of dehydration. Do you think this is making me more hungry? Definitely. If your body needs, that will be a cellular hunger. Your cells are in need of liquid. So even if you get a little bit of liquid from food, that will be satisfying at some point that need. So dehydration, chronic dehydration can definitely cause weight gain. So if you think you're overeating, always observe your liquid intake. If you are not into drinking water, which is something common more with gastric sleeve, I don't feel comfortable when I drink water, or I drink water and I feel full and I don't like that fullness sensation. Just remember, we need to be sipping constantly. You can add some infusion, some herbs, some fruit to your water in order to make it more tasty. You can do cold tea or cold infusions, and that could make it more attractive. But definitely, first of all, it's one of the first things that we recommend. Check your hydration. And possibly you are not going to be feeling as hungry as you are now, and not looking for so many snacks if that's the case.
Another thing that I want to mention is being hungry. Like a lot of patients will tell me, "Oh, I eat and I still feel hungry. Still feel hungry, and I have hunger pains." That can be related to an inflammation of the mucus in your stomach, and that can be caused by gastritis. A lot of patients have that as an illness, and they don't think it's an illness. They say, "Oh, I have ¿cómo se dice? Indigestion?
Indigestion?
Indigestion. I cannot say that word. And they don't think it's something that it's an illness that they have, but they have been taking antacids for years. They have tons of Tums all the time. It's not something that will go away just by doing the surgery. It even gets worse. And if you're constantly hungry, that is one of the causes for you to feel hungry most of the time. Acid problems. So start an antacid. If it doesn't get better, you need to see what's causing you. Maybe a bacteria, maybe some medications are bothering your stomach. Chronic medications will make you have that illness. So always check. Even if you have had it for a long time, it's not normal. So you need to check on that. Even we recommended to do it before surgery. It's better to prevent, and having the surgery and having that problem on top of it, it's not good.
Okay. Is it normal after 6 years to stay full for 3 hours after eating? Could be, especially if it's more protein and fat in the meal versus if it's low carbohydrate. Yeah, definitely. The carbohydrates and liquids empty faster from the stomach, so will provide you less satiety. And if it's higher fat, higher protein, then you can be satisfied for a longer time.
Longer periods.
We also have another question. Is it possible to lose a little more weight at the beginning in order to be in your weight goal?
Ideal weight.
Afterwards. What do you think, doctor?
I'm gonna speak in my personal opinion. I lost a lot of weight, and I was very thin. So it's not something that I could
control.
It's not something that you can control. If you start to starvate yourself, you cannot even lose weight because your body will protect itself. So it's not something that maybe you can control. And like we said, the best way to keep that weight off, it's healthy lifestyle, activity. If you want to maintain, it's not something that you can control by losing more weight at the beginning. No. And it all depends on your BMI, of course. But I don't think so.
And doctor, if you can share a little bit with us, why do you think Dr. Velasco has a gastric bypass? It was how many years ago? 8 years ago?
I think, yeah.
Why do you think you were able to lose the weight and actually keep it off and maintain it in these last years, even with your recent pregnancy? Why do you think you were able to have success with your procedure? What were the main tools?
I think it's very personal. I don't ever overeat, ever. It's not common in me, even when I was obese. I do, and people who know me know that I love sweets, but I get sick. I feel nauseous, so that keeps me from doing those things. I used to love pasta. I do eat pasta, but I don't ever overeat. So that, like, I'm afraid to feel sick, you know? So I eat, but I maintain always a small portion since I don't overeat, and it's something personal. I don't control my portions. I just do it because it's something that I never have done it on the past. And whenever I go out, I like to order always meat or protein or
So
seafood.
you say you kind of follow the plate method, your protein first and then the rest of the food.
And I do eat everything. Everybody that knows me know that I love sweets. I love bread. I love bread. But I try not to overeat. I grab a piece of bread, but I don't have to finish the whole thing. I like to eat. I like to try everything, small portions. And one thing, I don't drink a lot when I eat. It's I like to eat teas, and if I'm having like a glass of wine, I don't. You're sipping. It's not like you gulp whatever you're drinking. I don't mix that much.
And can you still feel dumping although you are so many years out of the surgery?
Yes.
Yes, right.
Every day, if I abuse sweets, if I abuse creamy stuff, yes, I feel dumping.
Okay. Thank you so much for sharing with us, doctor. We're running out of time, but next time we can possibly share more about our personal experiences and like the journeys. There's people that we want to interview and to just share with us their experience. Let me just answer a couple of questions more so we can close the session. I will post you like an abstract of what we talked, so we will have it available in the group. Hold on a little second. Okay, we answered those.
I think they're all.
Tiffany sent me a message later about the vegetarian diet. Being vegetarian after the surgery, it's not impossible, but we will have to evaluate your individual case in order to see if that's the best option for you, but we can definitely support you with that. Okay, the protein checks, we answered that. Okay. Yeah, the same with Kelly. Please contact us in order to help you with your personal case. And everyone else, if we're missing.
Can anybody join your group? Where can I find it?
Okay. Well, the support group, it's basically for Dr. Garcia's patients and with their companies, Tijuana Bariatrics and Tijuana Bariatric Support Group. Tijuana Bariatric Center. The reason is that, as we said before, we have over 7,000 patients already, so it's difficult for us to keep up with everything. So we try to, be as efficient as possible. Talking about that, normally we try to reply in the next 48 hours because we get about 100 messages a day between the emails and the social media. So please be patient. And if it's an urgency, that will be contacting the doctors. But sometimes we will recommend to go with your doctor over there, since it's
and it's primary to Dr. Garcia's patients. All others patients who have done surgery with other surgeons, they should have their support group, and it's basically our patients. So we can help. Of course, we can help, but it is very important for us to keep up with the follow up and helping our patients, but I don't know.
Yes, and there are many groups that are open to everyone, but as for us, we do ask for questions in order to join us. But like this, our Facebook pages, and also you can all follow us on Instagram. They're open for everyone. So if you're looking into having a gastric surgery, you can definitely contact us through the coordinators or our pages. We have to go and see our patients. We are actually at Sarah Hospital up here. This is Dr. Garcia's office. We were hoping to see him at some point, but he's down in the OR doing its thing. So he says hi to everyone. Thank you so much for trusting us. Hopefully this was a helpful session for you. We are a little shy, as you can see. We get nervous, but we will be practicing more. And yeah, thank you so much. Thank you so much. You have a beautiful day. Don't hesitate to contact us if you have any questions about the session. And again, thank you so much, Dr. Velasco.
Thank you, Linda.
We are planning a session with Dr. Gastelum, our internist doctor.
And we're doing a challenge. We don't know exactly. We were talking about it, but we're not really. We didn't put it together, but we're gonna do a challenge. Some of us.
Yes. Well, since we said before, we're not only health practitioners. We also have our own journey with our bariatric surgeries. We're planning a challenge. We're getting together with our team in order to participate in the challenge. And it's going to include some physical activity aspects and the nutrition aspect. So we're really excited. So we would like you to participate. And again, we are going to be patients too. So you guys will...
Well, we are, but we're going to be in the same boat as you, okay? So thank you everyone that view our video. It's not so much fun for me, but I try to help. So thank you for everything, and we'll keep in touch, okay?
Bye. Thank you.